Hello, I'm Dr. Joshua Pate, a senior lecturer in physiotherapy at UTS. Have you ever wondered what it takes to be a physiotherapist? Today, I'll be answering your questions, so let's get started. What do I need to study to become a physiotherapist? It depends on the institution. Here at UTS, people do a Bachelor of Sports Science or Exercise Science or a Health Science subject, and then it's a 2-year postgraduate master's course to become a physiotherapist. There's different models out there, but we find this really works nicely because then people have time to kind of grow and develop as a health professional, and then they go on lots of different placements throughout the degree and feel really equipped based on the data that we have. What kinds of settings do physiotherapists work in? Physios can work in a hospital setting or in a private clinic setting or a home-based therapy or a sporting field, or there's animal physio. There's lots of different ways that you can work clinically as a physiotherapist. There's also policy roles, managerial roles, like administrative roles, lots of different roles there. And then in the university system, there's academic jobs like teaching and research as well. And I think most people who are signing up to become a physiotherapist are focused on those clinical opportunities, and there are so many different possibilities. What does a physiotherapist do in their day-to-day work? It varies a lot from setting to setting. When I was a new graduate physiotherapist, I was in a hospital setting, and I'd basically see patient after patient all day, every day. And that's a great kind of work pathway, and I really enjoyed that. When I worked in a pain clinic, I would run group programs, and so some days of the week I would be doing more or less of that, and kind of more complex, longer assessments as well. And so I think it really does vary and depend on where you're working. Like if you're working at a grand final or something like that in a sporting field, you're obviously not in a clinic, and that's such a different environment as well. So there's lots of different possibilities and lots of different options, which is great. What skills are important for a physiotherapist to have? I think one of the key skills would be communication skills. Working alongside patients is really challenging at times, and being able to get on the same page is so important. I think variables like empathy matter so much in terms of the research and the outcomes that we see. And so having those skills kind of to back up your clinical skills are really useful. What challenges do physiotherapists usually face in their work? There's a range of different challenges that someone might face. In a private clinic, for instance, there could be pressures to see lots of patients, or in some settings, patients have varying levels of motivation and you might take it personally, or in other settings, patients are at the end of their life and it's emotionally very challenging to work, or maybe it's working in different teams and different settings like that. And I think there's so many possibilities. And so the challenges, ultimately, it would vary from person to person and setting to setting, but they're certainly able to be overcome. What do you love most about being a physiotherapist? I really like the long-term outcomes. I love when a person can look back and see that physiotherapy has made a huge difference and helped them get back to doing the activities that they love doing. I think that's what I find most rewarding. And I also love seeing that even in my teaching work, when a student, they have that aha moment and it transforms the way that they will deliver patient care on placements and in the future. What's the biggest misconception about being a physiotherapist? A lot of people, when they think of physio, can imagine the Olympics and you see the physio standing there on the sideline or racing on when someone's injured. And I think just a common misconception is that that's all a physio is. The breadth of the profession is the biggest misconception that I've observed. What's your top tip or best piece of advice for someone who wants to become a physiotherapist? I'd encourage you not to underestimate how important communication skills are. And that might mean getting a part-time job or shadowing in a clinic or seeing what it looks like to work in that dream job that you're imagining. Thinking really hard about why you want to work in that role will allow you to kind of chase that dream and gradually chip away, because it can take a long time to do that. And so working on those skills like working in a team is a really critical first step to head towards becoming a physiotherapist. Well, that's all the questions for today. If this got you interested, check out the UTS website and search physiotherapy to learn more about working in this field.